There is something common among all of us. We all work in a factory and we usually come across a very common issue, that is substance use. Hello everyone, my name is Dr. Snehil Pancholi, and in this video we are going to talk about the awareness and prevention program about the substance use. So let's see some learning objectives of this video. First, we will try to understand what is substance use and what are its impact on the factory workers. Then we will recognize some workplace risk factors that cause the substance use among the factory workers. Then we will try to identify the warning signs of the substance use among the factory workers. Then at the end we will discuss some prevention support strategies, how to prevent substance use, how to support these kind of factory workers. So now let's see what is substance use. As per the definition, use of alcohol, tobacco or any kind of psychoactive substances. This is called substance use. I repeat, use of alcohol, tobacco or any kind of psychoactive substances. This is called substance use. Please do not indulge into all these things. It can range from occasional use to complete dependence. It may affect health, family life and work performance of the factory workers. Family life also gets affected, social life also gets affected, and of course work performance always gets affected because of the substance use. So now in this figure you can already see some common substances used are alcohol. Maximum impact is caused by the alcohol only, as you can already see in this figure. Then comes tobacco. Smoking or non-smoking, smokeless. Smoking tobacco means bidi, cigarette. Smokeless means gutka, tamaku, khani, all these things. Then comes cannabis, bhang in Hindi it is called. Then comes prescription drug misuse. Then comes other illicit substances. So now we'll see why factory workers are vulnerable to substance use. Because of the shift duties, irregular schedules, occupational stress. Occupational stress is workload is more as compared to the capacity of the worker. This causes occupational stress. Then peer pressure. This is very important, and I will tell you a small story about this. It is something like हम तो डूबे सनम तुमको भी ले डूबेंगे. So the story is something like a group of monkeys were put in a small box. The first monkey in that group tries to climb out of that box, but the other monkeys keep pulling his leg and they don't let him climb out of the box. Second monkey also tries, same thing happens to him. Third monkey, fourth monkey, ultimately the whole group. So they stay in that box thinking that we can't get out of this box or sit in this only. Now after some days a new monkey was put in that box. This monkey climbs and he succeeds to come out of that box. He doesn't pay any attention to any kind of leg pulling and all these things. He doesn't pay any attention to the peer pressure. So this peer pressure is something like they do not live also and they don't let live also. So you need to be careful about these kind of peers. Peers means your friends. They are not basically your friends, they are your enemies. सिगरेट पकड़ा दी उसने तुमको. Next we will see fatigue and sleep disturbances. This is very common among the factory workers and it usually causes the substance use. The factory worker feels fatigue. He doesn't know how to resolve it. So he falls into substance use and starts drinking and taking tobacco unnecessarily. Sleep disturbances, some people do not sleep overnight. They completely get indulged into mobile watching and all these things. So that also causes sleep disturbances, maybe due to some mental health issues also, or maybe due to some social problems. Any kind of reason that causes sleep disturbances among the factory workers, then they fall into substance use. So you should always advise them, educate them to take proper sleep, take proper rests to avoid fatigue, avoid occupational stress, avoid irregular schedules, and of course peer pressure. Be careful about your peers. Then the factory workers might have some personal and social problems like already discussed, mental health issues, anxiety, depression, or any other personal issue, financial issue, or any social problems like he is not able to mix with others because of certain reasons. Workplace bullying and all these things are very common these days. So you need to be very careful about all these things. Now we'll see what is the impact on the worker's health, impact of substance use. So as you already know, substance use causes liver diseases, hypertension, respiratory illnesses, mental health problems, sleep disturbances, and risk of dependence and withdrawal. Complete dependence can occur. The factory worker cannot live without that substance. So that is very dangerous, very risky. He might suffer withdrawal symptoms also. So you need to be very careful and we should train those people, train the factory workers about all these things, dependence, withdrawal. So first you yourself need to be trained about all these things. Then only you can train the factory worker. So this is what the video is about actually. So now there is also an impact on the workplace safety. If the factory worker is under the influence of the substance, then it causes decreased concentration, judgment, delayed reaction time, delayed response, increased accidents, near misses. So near misses, one video we will completely dedicate to this near misses. I will explain all the what exactly the near misses is in that video. So now absenteeism also very common due to substance use. The worker, factory worker starts remaining absent for many days without any particular reason, without any explainable reason. Then it obviously causes reduced productivity of the factory. substance use, factory workers falling in substance use, then obviously productivity of the factory gets affected. So now this is very important and you need to be very cautious about these warning signs of the substance use. You need to train the supervisors about these warning signs. How do the supervisors identify that the factory workers are suffering from any substance use? So these warning signs are our milestones. You need to learn these warning signs, basically train the supervisor itself. So first, frequent lateness or absenteeism the factory worker will show. Decline job performance. His job performance would always decline because of the substance use. He would show mood swings, irritability, poor coordination, repeated safety violations. All these are the warning signs. You need to learn these first yourself and then you need to train the supervisors about these warning signs. These are the warning signs you need to see in all the factory workers. If someone is reporting lateness, absenteeism, decreased job performance, mood swings, irritability, poor coordination. Poor coordination means among themselves, with the supervisors, is not coordinating properly. You would always do repeated safety violation, all these things. Now we'll see prevention strategies, how to prevent these kind of substance use. Health education and awareness programs. Daily health education. Gong, 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 gong. You need to put that into the subconscious mind of the factory workers. This you can do only if you educate them regularly. Every morning, TVTs you have to conduct, health education you have to conduct, awareness programs you have to conduct. This you have to do, good or bad, right or wrong, please make it a point. Health education, awareness programs, TVTs regularly. Strong workplace policies. The administration, you should address the administration, management to put some strong workplace policies if you come across these kind of substance use in the factory. Regular medical examinations should be done of the factory workers to screen out all the substance use. Then most importantly, supervisor training. This you have to do. This you have to train. The supervisors you have to train. Train them to identify the warning signs among the factory workers, warning signs of substance use. We already discussed in the previous slide. Now promoting healthy coping mechanisms. Need to educate the factory workers to apply healthy coping mechanisms in their lives. Healthy coping mechanisms we will see here in this slide how workers can protect themselves. So you need to train the workers also how they would cope. Tell them to avoid using substances to cope with the stress. No need to use alcohol, tobacco or any kind of substance just to cope with the stress, occupational stress or any kind of stress he is having. Just to cope with the stress, you don't have to fall into substance use. This you have to repeat every day. Adopt healthy lifestyles. Train the factory workers to adopt healthy lifestyles. regular exercises, small exercises are enough, 20 minutes, 25 minutes, that's it. Regular morning walks or mild exercises and green vegetables, fresh fruits, meditation, relaxation, mind relaxation techniques, all these things you have to tell them. Ask them to seek support early. If they find any kind of warning sign, then please ask the factory workers to seek early support. It is always available at the OHC. Participate in the wellness program. You should always promote the factory workers, educate them to participate in the wellness programs. Wellness programs we are running at the OHC also. The management also conducts so many wellness programs here and there. So this is also one of the wellness program only, awareness wellness program. So role of supervisors and peers. Supervisors are very important and peers of the factory workers, they are also very important. Supervisors, they should be properly trained to recognize early warning signs. Then peers should encourage workers to seek help. Avoid stigma and discrimination. This is very important. These days, any kind of stigma is always discouraged. Mental health stigma, talking about mental health, it is no longer a stigma. Talking about substance use is no longer a stigma. And any kind of discrimination also you should discourage. Discrimination, just to speak about a little about it, discrimination means like disability, any kind of disability the factory worker is having, cleft lip, cleft palate, or any disability like limping in the gait or some problem he is having. So please do not discriminate those factory workers. They are also part of our system. You have to include them. Inclusiveness is very important these days. Report safety concerns appropriately. Any safety concern is there because of the substance use, just report it appropriately and early also. Immediately you should report. Do not hold back the information. Okay, so I will talk about Employee Assistance Program, EAP. This is a program which every organization, every factory has for its factory workers. So under this program, they usually conduct confidential counseling services. Counseling they provide, confidential counseling. Then timely referral to specialists as and when needed. If the factory workers need any specialists, then timely referral is provided. So support for employees and families. This is also a very important aspect of employee assistance program. And facilitating return to work. Once the factory worker is sick, then OHC team approves, then only the patient can return to work. So all these things usually are facilitated by employee assistance program. Okay, so now the key messages of this presentation. Substance use is preventable and treatable. You should please ask the factory workers You should educate them that it is completely preventable and treatable if they recognize it and try to speak to the OHC team or any psychological support system, then they can help. Early identification saves lives. This you already know. A safe workplace is everyone's responsibility. This is a well-known fact. Substance use compromises the workplace safety, so you should always discourage it. Help is always available at OHC, at management also. So thank you all for watching this video. This was a very wonderful time to share with you a substance use awareness program. Hope to see you all in one of my next video.